Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Welcome back to another episode of Dental Fuel. Dental Fuel is brought to you by 90 Day Jumpstart, a program to help you increase production and break free from financial stress. If you've heard him speak before, you know that this week's guest is a special person. Dr. Mark Hyman joins us at Dental Fuel to share some mistakes and some pearls of wisdom. Dr. Hyman is a distinguished dental professional with an illustrious career spanning over 3 decades. He is a quadruple Tar Heel with undergraduate dental school and residency credentials from the University of North Carolina at Chapel Hill. In this episode, Dr. Hyman recounts his early career struggles and the pivotal moments that led to his success. He highlights the importance of mentorship and continuous learning in the dental field. Let's listen in to our conversation with Dr. Hyman and a clinical mistake that he has made. Dr. Mark Hyman, welcome to Dental Fuel. How are you doing today?
Dr. Tanya Sue, what a joy it is to see you. It's neat to meet a rising star. I should have gotten autographs while they're affordable. I understand It's too late for that, so maybe later.
I'll send an autograph. No, I'm just teasing. That's very kind of you to say. I should be the one asking for the autograph.
I don't think so. We're all on the same team. I'm very proud of what you've done at a young age in such a short amount of time and the great things you're doing down in Texas. And
well, thank you for that. That's very special.
Look forward to your message going national and international.
Oh, thank you. Thank you for that. Well, Mark, thank you so much for joining me today at Dental Fuel. I'm so excited to share with our listeners a little bit about who you are and your message to the world. But before we get into it, I would love if you would tell our listeners a little bit about yourself.
Sure. Tanya Sue, what is impressive about me is very little. I would be voted the least likely to succeed in my dental class. I'm a quadruple Tar Heel, University of North Carolina at Chapel Hill, undergraduate, dental school, residency. Now I teach at the UNC Adams School of Dentistry. I was our class president, just jamming, coaching intramural basketball and playing soccer and t-ball. And midterms came, I kind of forgot to study and I got crushed. And actually the first week back of spring semester, first year dental school, I quit dental school. I was sitting in my apartment on a Thursday night trying to cry and nothing would come out. And the only way I could go to sleep was to say this nightmare is over. And I went to see the dean. I was our class president, and I had a big presence at the school. Went to see the dean, told him I was going to quit. He said, great, go into class, come back at halftime, and I'll sign you out. So with my tail between my legs, I went slinking down the hall at the UNC Adams School of Dentistry and ran into a young professor, Dr. Ron Strauss, who saved my life. And he said, Mark, it's okay. Being a dental student is nothing like being a dentist. Give it another hour, give it a day, see how you do. I had a decent morning, went back to the dean, told him I wasn't going to quit, and he acted disappointed. May he rest in pieces. And I muddled my way through the rest of spring semester, started in clinic that summer, caught fire, and I graduated dental school in 3.5 years. We don't let you do that anymore because we want that last tuition payment. So I had 6 months to kill before I started a 2-year oral medicine hospital dental residency at Chapel Hill. And I joined American Dental Volunteers for Israel and moved to the Holy Land, grew a beard, grew my hair long. My first week in Israel, I did more work than I'd done in 3.5 years in Chapel Hill. And lived just north of the Sea of Galilee, right at the foot of the Golan Heights. It was an unbelievable experience. I did that for 4 months. And my last week there, I was in the Jerusalem bus station. I look up and I see this face, and I was like, God, she's cute. I won't get to talk to her. I went and sat in the back of the bus. Here comes 22-year-old Anita strutting, tight Calvin Klein jeans, hair all dolled up, funky scarf, walks her up to me. So with 2 other Americans, she leans in and goes, hi, guys, want company? So we talked for 4 hours and got engaged 5 months later. So as of last month, it was our 39th anniversary. So it just might work out. We'll see. So I did the residency in Chapel Hill. July 1st, 1986, I bought a bankrupt practice in Greensboro, North Carolina, and made it worse. Dr. Tanya Sue, there's kind of a recurring theme here, isn't there? I start something, I faceplant, and then I blast it. So I bought this bankrupt practice, made it worse, and then God smiled upon me because I went to a Linda Miles seminar. If you don't know of Linda Miles, she is the grand dame of practice management leadership. She is the person most responsible for our valuing our dental teammates. And she looked at me, some pathetic character from some Oliver Twist novel. Please, sir, I have some more. I said, Linda, I bought this practice. I don't know what I'm doing. And she said, poor child, let's have lunch. And she listened to me whine and moan and complain and said, why don't you do this, that, this, that? Gave me 5 little ideas. Next month, the practice doubled and then doubled and doubled and doubled. So God bless Miss Linda Miles, Dr. Kathy Jameson from Oklahoma, Miss Naomi Rohde from Arizona, Gordon Christensen from Utah, Erwin Becker from the Pankey Institute. These men and women put such a tremendous amount into me. So I love that I get the privilege now of mentoring the next generation of young speakers and superstars in dentistry like you. So that's my story.
Well,
I bought a bankrupt practice, made it worse, had 2.5 employees. And then by the end of my career, we had top 1% practice in the United States with production, collection, overhead control, team retention, and fun. So I started doing mom and pop speaking, and the professor Ron Strauss, who had saved my life, asked me in 1989 to come back to the dental school at Chapel Hill and tell my story. And that was pretty amazing. That was really my first public seminar, first public speech. It took 10 years doing little mom and pop study clubs and little things till I spoke at the CDA at Anaheim in April in 1999. In 1999, I had 5 seminars. 2000, I had 20. This past year, I had 51. So I had 32 years of private practice, which I adored. And then my back gave out. My L4, L5 blew out. So I can't practice anymore, and that was kind of heartbreaking. But I'm teaching at the dental school at Chapel Hill. I'm on the admissions committee and about 20 other committees. And I have the privilege of the podium of speaking. I'll be at the Hinman in Atlanta. I've got Star of the North, Star of the South. I got the ADA in New Orleans coming up in the fall. And I've just loved the privilege of sharing the message of our type of dentistry.
Mark, thank you for sharing your story. Very beautiful message as well, too, in the sense that you are sharing that something that I feel that I am a product of those who support me, those who mentor me, and those who believe that I can take the next step forward. And so I really resonate with what you just shared. And to our listeners who maybe have not had the opportunity to listen to you speak at the podium at one of these events, I highly encourage them to seek you out. And I hope that by the end of our conversation, they will understand why. And I'm excited to have you here at Dental Fuel. Here at Dental Fuel, we are dedicated to talking to industry leaders and discussing our mistakes and learning from those mistakes so that way together collectively we can become better practitioners and better in the world of dentistry. And I'm very excited personally to listen to the mistakes that you have potentially made in your career. Obviously, you have shared one already. And I'm sure we'll talk a little bit more about that. But the first mistake I'd like to talk about is a clinical mistake that you've made in your career and how you handled it.
Boy. We have an hour and a half, right, to talk about my
that's
mistakes.
right. I got all your time. I'm on your time.
That's just the letter A. You know, I pulled a wisdom tooth on a patient early in my career, and I said, are you on any medications? No. You're not taking medications? No. Great. Pull the tooth. Blood is pouring out like a spigot. I said, sir, are you on any medications? He said, no. I said, you didn't take anything? He said, well, I took 10 aspirin before I came in. I'm like, oh my God. So I didn't ask, are there any prescription or over-the-counter medications or any homeopathic medications? So that was a mistake. One of the great cases I like to show in my seminars is a case about Karen. It's a woman who actually I got to do my full upper rehab on. And I was just a dancing bear. This was 1989, and I prepped all the upper teeth, cemented them all a few weeks later. 6 months later, she came back to let me do the mandible. And I'm like, this is awesome. And I did the mandible and cemented that. And the years went by. When I look at the pictures of it now, if you look at the left side, the occlusion, it looks like the letter L. It is so bad. Curva Spies, anterior, posterior, curva Wilson's transverse, completely screwed it up. And it lasted 29 years. So I look at that, and every time I look at that, I kind of go, you're such a loser, except it lasted almost 3 decades. And she and I started talking about redoing it for years before she let me, and she was in a horrible marriage. Tanya Sue, she kept looking at me saying, Dr. Mark, I can't do it. I want to redo it. I just can't do it. He won't let me. He won't let me. This went on over year after year after year. And then he died. I'm sorry. The wicked husband died, and she came in and said, "He's dead. Let's roll." And I'm like, this is really creepy, but sure.
Yeah, well, let's do it.
So when I love to show that in my seminars, because I don't tell the audience who did the case. I just show them the dentistry, and the porcelain's cracked and the occlusion's horrible. And I'm like, God, who did this work? Would any of you go to a seminar by a speaker who did this work? And then I say, well, I'd like to thank you for coming because I did it. And that was 1989. In 1990, I started going to the Pankey Institute in Key Biscayne, Florida, which was the transformational moment of my dental career, technically. My time at Pankey just completely transformed my career, where Dr. Erwin Becker and the crew got me to stop looking at single teeth and to take a step back and look at the entire patient. Really study the medical dental history. Sit down and ask the patient, what are your goals for your health and teeth and your smile? To go through an unbelievable new patient experience where you keep asking open-ended questions. If we have time briefly, the 10 questions I kind of run through, I used to say, Tanya Sue, do you have any trouble finding your way to the office? With Google Maps, it's kind of an antiquated question. So then I would say, who can I thank for referring you? Because there's a big distinction between you're part of my PPO, you have to see me. And Dr. Ashley Clark said, you're expensive, but you're the best. And then I would say 5 magic words. How can I help you? In your own words, why'd you come in today? How can I help you? Patients will often say, I hate my smile. The temptation is to say, well, that's because you have diastema between 8 and 9 and class 2 D2 laterals and a Vita shade A17, and your mama dressed you funny. I say to folks, don't do that. Keep asking questions. How can I help you? I hate my smile. Tell me more. What about your smile do you hate? Is it color, size, shape? Well, I hate the color, size, shape of my teeth. And how does that make you feel? I don't smile for pictures. Do you have pictures coming up? You keep asking the questions. 2 things, Dr. Tanya Sue, that people don't ask is, what did your last dentist tell you? It's a huge question. You just left the dentist a week ago and came to see me, but what did they tell you?
Mm-hmm.
And often they'll say, well, he was pushing crowns. And then I'd say, well, do you think you need one? And almost always they'd say, I don't know. And then I'd say this magic expression, if I see changes going on in your mouth, do I have your permission to tell you? When the patient says, yes, it's supper time, it's a great time to be a dentist. Okay. Then we keep going through the process and say, why now? Why'd you come in today versus next week, next month, next year? What's the urgency to act? One of the cases I show in my seminar, a woman came in, I hate my smile. My daughter's getting married. I said, really? When? She said, Saturday. And I'm like, oh my God. You going to do 10 veneers right before the wedding? Well, yeah, I did. 911, we went into overdrive. The team kicked in. It was amazing. So these are these type of questions. What are your goals for your health, teeth, and smile? Do you have a budget? Who else is part of the decision maker? And when do you want to be finished? Dr. Tanya Sue, where's the insurance question?
Not there.
Because I don't care. I care deeply the patients get what they want. And actually, I have a whole seminar called The Questions You Hate, the Answers You'll Love, where I go over every oppositional question a patient said, including, what will the insurance pay? To which I would say, it's a good question. What if they don't pay a penny? You said you hate your smile. You said a wedding's coming up. Who's the decision maker here, Aetna or you? So
a few great things
career,
that I'm hearing
the biggest the clinical mistakes usually were that I wasn't prepared. I jumped in too fast. I didn't really get to know my patient, because that is one of the best ways to either get bit in the butt or to be successful, is to really outlisten the competition.
I really love what I'm hearing here. And 2 things that stand out for me is, asking the patient if they are open to hearing that feedback, open to hearing what's going wrong in their mouth. There are so many times where I have patients come in and, I try to go through things that are going wrong, and they're like, that's your personal opinion. You can keep that. I'm like, it's a little bit frustrating, because in my mind, it is my role as a practitioner, as a clinician, as a dentist, to provide them that information and help them make an educated decision for the next steps. But if they're not at that point to be open to that information, they're not going to be open to taking those next steps.
You have to get their permission to take them to the next step. And if they're not ready, There's an expression my dear friend Dr. Keith Phillips, who teaches with me at UNC, says your patient's always right? They just don't have to be your patient. Where they are in their life at this time, it's okay, man, but they just don't have to be your patient. You can look at them and say, what you need is not what I do. Somebody comes in and says, Dr. Tanya Sue, I don't want exam, and I don't want x-rays, and I don't want probing. You don't have to have it, but you just can't be a patient here. I'm not putting my name on an incomplete exam. So my coach, Dr. Kathy Jameson, has another wonderful little series of asks. Dr. Tanya Sue, can I ask you a question?
Yes, please.
If you give me permission to do the most thorough exam you've ever had, I'm going to study your pictures and x-rays and models, and we're going to sit down and talk about it. Then you have my permission to do some of it, all of it, none of it. And you'll see a patient just melt. If you give me permission to really dig in and look here, I'll present to you what I think is the very finest dentistry, and then you can do all of it, part of it, none of it. It's your body, it's your health. Do you like the way that sounds?
I do. I sure do.
And if they say no, then you say, God bless, good luck, who's next?
Dr. Hyman joins us next week once again for another episode where he shares a financial mistake, and it's a big one. Be sure to tune in. If you're looking to grow your practice and need some help along the way, be sure to check out 90 Day Jumpstart. You can start for free by contacting Dr. David Rice. Check out the link to his Calendly in the show notes.